everyone.
We lost her. Here she is.
Attempt number 2. Can everyone hear me? Oh. Can you hear me all?
Yes.
Okay. It started recording and then I got kicked out. I apologize. Good evening, everyone. I want to thank you all for taking the time to join us tonight. We have wonderful panelists planned for today's discussion on social justice and psychiatry. And of course, none of this will be possible without continued support from all of you, as well as our sponsors. So tonight's sponsors are Professional Risk Management Services, or PRMS, American Professional Agency, so APA Inc., and then Janssen Pharmaceuticals. So for our first sponsor, we have APA Inc. here today, and we actually have a representative. So if you have any questions, you can please feel free to reach out to Ms. Christine Cotter. And then for our second sponsor, we have Janssen Pharmaceuticals. And our final sponsor of the night is PRMS. We'll actually have a few words from Mr. Rich Stagnato, who's here representing them today.
Hi, everybody. It's great to see everyone here on the conference. My name is Rich Stagnato with PRMS. We are a psychiatry-designed medical malpractice and risk management insurance program. So for any folks who are in the market or need malpractice insurance, definitely I encourage folks to check us out at prms.com. If you know any folks who are needing insurance or are graduating this summer, we do provide lots of good features and credits. For example, we do up to 80% off for new graduates completing their residency or final fellowship. And if you refer someone, they give you credit for it, you can have a donation made by us to any organization such as IPS for the referral, whether or not that psychiatrist purchases the insurance policy. And so we have a lot of information on our website at prms.com about that and other features and benefits, including everything that's kind of going on with, psychiatry and, the states and the feds are kind of playing, some rolling back, some not. So if folks are insured with our program, they can chat with the risk manager to see if they need a license in a particular state, et cetera. Things like that are some of the features that we provide and services we provide to our insured. So you don't have to, it's not like you get a bill and wait to be sued. There's other things you could take advantage of during the course of the year if and when needed. So thank you for everybody and hope everyone enjoys the talks.
Thank you very much. And a big thank you to all of our sponsors. For our main event, we're going to have presentations from 3 panelists today, and I'll provide a brief introduction to each of them so you can all have a little glimpse into their many accomplishments and the wonderful things that they have done. I'm delighted to introduce our first speaker tonight, Dr. Patrice Harris. She is board certified in psychiatry and has over 25 years of experience in private practice. She is a recognized expert in children's mental health and childhood trauma, and she has practiced adult, child, adolescent, and forensic psychiatry. In 2019, Dr. Harris was elected as the 174th president of the American Medical Association, and she is the first African-American woman elected to that position. Dr. Harris is also a visiting professor at Columbia University, an adjunct professor at Emory University School of Medicine, and an adjunct clinical assistant professor at Morehouse School of Medicine. She's received numerous awards in recognition of her service and leadership. And in 2020, she also founded a digital health company. Without further ado, I'll turn it over to Dr. Harris.
Well, thank you, Jasleen, and thank you to the Illinois Psychiatric Society for having me. And really, I have to congratulate you on having this conversation. Of course, this is one in a series of conversations, and you all are hitting the issue head on. And that is what is going to be required if we are going to really make a difference, if we are really going to move the needle around these topics. The conversations can be difficult, frustrating. They can make some people angry, but it's a commitment to the sustained conversations, I think, again, that will move the needle on this issue. And by the way, I have to say, and perhaps I hold psychiatrists to this standard, because who better than we? I've actually talked a lot about leadership in general. And in my various leadership roles, people have asked me what has best prepared me for some of these leadership roles. And I talk about my training as a psychiatrist. And I have to say, listen, we are not perfect, but we are more comfortable, I think, than most in having uncomfortable conversations and surfacing elephants in the room, right? So certainly you all are leading by example. IPS is leading by example in having this series. And it will require, again, sustained conversations. Everyone is on their journey. Just in my experience from speaking at universities large and small, private and public, talking to individuals, talking to state district branches and state medical associations, corporations. All of us are on this country. All of us are on a journey. We're all at different places. There is no one size fits all, but it really requires these conversations and a commitment to learning, a commitment to some humility that we will move forward. So I'll have just a brief slide presentation, a little bit about my experience and how I view sort of health inequities and some of the conversations and definitions that we should start with, a few things about psychiatry, and then I look forward to the rest of the conversation. So I've found over the years it sometimes is an adventure in sharing your screen. So let's see if I'm successful. Someone can give me the thumbs up and let me know if I am successful in sharing my screen. Great. So you've heard a lot about me. I want to say two things. I want you, number one, to put your face in the place of my face here, because the one thing I want to say is we all have to remember self-care. Even prior to this pandemic, we've seen physicians, nurses, many of us in the health professions experiencing burnout, right? And sort of, and no one sort of thinking about systems and how the healthcare system is impacting our ability to care for our patients. So let's remember self-care. I express my sincere gratitude to all of you for the work that you have done and will continue to do. This is, though, a photo of me on the night of my inauguration as 174th president of the American Medical Association. And I want to also thank you, because it is because of psychiatrists across this country and those that you support as your delegates to the AMA that I was elected to this position, the third psychiatrist, the first child and adolescent psychiatrist. And on the night of my inauguration, I said I wanted to amplify three things. Number one, the importance of mental health into overall healthcare. Number two, the importance of diversity of the physician workforce. I was talking about that night was an audience of physicians, but we really need diversity of the workforce, no matter your profession, no matter your specialty. And by the way, and many of you know this, not just in the service of a checkbox, right? Not just in counting the numbers of women that you have, the numbers of African Americans that you have, the number of Hispanic colleagues that you have, but really in the service of equity and health equity. And the last thing I wanted to amplify during my year as president, in addition to the AMA's priorities, was the importance of trauma. particularly childhood trauma, but trauma. And of course, no one of us wish this pandemic on our world, but clearly these issues and many more have been raised and amplified. The need for mental health care, actually the lack of a woefully underfunded mental health infrastructure in this country, public health infrastructure, and certainly issues around health disparities and health inequities, and racial justice and injustice. Clearly, none of those issues were new, but I say, particularly around issues around George Floyd and racial injustice, and issues around health inequity, we didn't have our usual distractions in this country, right? Typically, we have our usual distractions. You know, for me, I'm a sports fan, so professional sports. But we were all, many of us, actually, those of us who had privilege, I like to say, were at home. But at any rate, we did not have our usual distractions, and we could not look away. And so, what are we going to do? We cannot miss this moment to address all of the issues that I talked about. But tonight we're going to talk about health inequities and issues around social justice. But I always like to start with a broad lens. And as we think about health, first of all, let's think about what creates health. Because I think for far too long in this country, and actually that still remains the case, we think of health in silos, and we think of health in traditional ways. And whether or not you have health insurance, critical. Whether or not you have access to a usual source of care, critical. But there are so many more other issues that impact health. And people talk about the social drivers of health, and certainly past discriminatory history and racism and bias, and all of these things contribute to health. And so I think we know these things in the abstract, but I like this slide because it puts it down and it talks about, again, the social inequities, institutional inequities, our policies and procedures. And many of you may have heard about redlining. And how about, if you haven't thought about it, how we built the interstate system in this country, right? We built the interstate system in this country in a lot of places right through African-American neighborhoods, right? And so if we think about then connect the dots, and there's so many dots to connect, but just a few, if we think about how we fund education, and that is certainly a social driver of health, think about how we fund education in this country, property taxes, and think about those areas where the interstate ran straight through these communities. Of course, it devalued their properties, right? And of course, some people moved, but many people could not move. And one of the reasons many people could not move was a history of discriminatory lending, right? And redlining. So all of these issues, and then property tax bases lower in those communities. And certainly they do not have well-funded schools. So it's critical to know all these things and then connect the dots. And also realize that this is not ancient history, this is today history, and we still have a long ways to go. And clearly, yes, absolutely, individual behaviors impact our health, right? I had a very unhealthy lunch today, so individual behaviors do impact our health. But here's the thing that I have choices. And you know, even in COVID, there were conversations, and then people tended to start to blame folks. Well, if you had a comorbid disorder, or maybe if you certainly had diabetes or hypertension, but if you were overweight, and then people were saying, certain people, not everyone, were saying, well, you know, people should just eat healthier diets. You know, we were having these conversations even pre-COVID. And if you think about that, okay. But the choices people make are based on the choices that they have. And we all know about food deserts. And so if you don't have that choice, right? If it is not, if you don't have a car, I have a car, I can jump in my car and I'm 5 minutes away from a grocery store. But I was on a panel one night with a colleague from Tulsa, Oklahoma, who said that in the zip code with the lowest life expectancy, if someone from that zip code wanted to even purchase healthy, fresh vegetables and fruit, they had to take a 2-hour bus ride to do that, right? 2-hour bus ride. And that is just one way. So all of these issues clearly impact. And again, when we talk about choices, let's make sure we understand that in context as well. But I do believe there's always opportunity. And so, you know, another way of looking at many of these issues is what are the actions we can take, right? And we know there are upstream actions that we need to take regarding affordable housing and policies and safe neighborhoods in the built environment. And there are midstream opportunities and of course, downstream. And let's say this too, because I'm often in an audience of physicians, and no, it is not physicians. It is not nurses. It is not the healthcare system alone to resolve all of these issues, but we have a front row seat often, right, to these issues. And we can be advocates. We can tell these stories of the work that needs to be done. And we, of course, again, need to do it on the societal level, the community level, and clearly at the individual and family level. But when we think about the individual and family level, we need to think about systems and how we can do what. I belong to a group here in Atlanta. We talk about the need to invert the burden of navigation through our systems away from the individual and on to the systems. When I was training at Emory, we had I can't remember the exact number, but maybe a 70 to 80% no-show rate in our clinics, in our child psychiatry clinic. And, you know, one of the things I remember thinking, okay, well, why? You know, that's the headline. And we often have to get beneath the headline. Why do we have this high no-show rate? What about the availability of daycare, the transportation? If you have more than one child, you have to get everyone to the clinic. You may have to go to school, pick up your child, and then bring them to the clinic. So again, we really have to be about the business of inverting the burden, understanding all those social drivers, the injustices that exist in systems. Yes, by the way, you know, we all have to make sure we are, and again, psychiatrists are pretty good at this, mental health professionals, of examining biases. And so we should do that on the individual level. And we should also make sure that we are thinking about the systemic level, certainly meeting people where they are. And I talked about having difficult conversations. And I will tell you the first part of having a difficult conversations is at least defining what you're talking about. I've seen over the last couple of years, again, people becoming defensive and listen, if that's your, you know, we are, we tell people, and I tell people to, you know, give yourself the grace to feel how you are feeling, but we also then should go to the next step. But at the very least, I've seen so many conversations, and there are, at the very end, you find out that people are not even talking about the same thing. So I typically, when someone comes up to me with a slogan, you know, or use terms that I know are in some ways incendiary, like you being woke, or, you know, I'm not a racist, I at least say, let's define the term. And here's a definition of racism that I like from Dr. Kamara Jones, because it really talks about systems that structure opportunities that give people some unfair advantage and others an unfair disadvantage. But clearly, and I love what she says, it saps the strength of this whole society. So clearly, people individually are impacted, but the whole society loses when we don't have these conversations. We don't define these terms, and we don't move forward. I like this cartoon. Many of you have probably seen this in some form. This is my favorite form because it demonstrates equality. A lot of times people talk about treating everyone the same. You can see that when you treat everyone the same in that slide, you still have some folks not being able to see over the fence. And equity is about giving people what they need. It means we need to have the data, disaggregate the data. We also have to appreciate reality. And this is some folks get an unfair advantage, and some folks, of course, get an unfair disadvantage. And justice is perhaps when there are no fences. There are no barriers. It absolutely is when there are no barriers for everyone to achieve their optimal health and mental health. And so the last thing I will say is, you know, as far as mental health is concerned, we've gone from you know, deciding that people who are enslaved have a mental disorder when they just wanted freedom. Remember that if you know your history of psychiatry, to now where communities of color have less access to care, where in certain instances, particularly Black men, overdiagnosed with schizophrenia. In the case of often Black youth, overdiagnosed with a behavioral problem, and I would say underdiagnosed with PTSD and ADHD. And so we do certainly have a ways to go, but when we are willing to have these conversations like tonight, I think we can certainly move forward. So thank you, and I look forward to the conversation.
Much, Dr. Harris, for such a wonderful presentation. We really appreciate it. I'm going to ask everyone to hold questions until the end. We are recording the presentations themselves, but once our Q&A session will begin, we'll actually cease the recording. I'll help facilitate the Q&A, and that'll allow for a little bit more of an open discussion. So it's now my pleasure to introduce our second presenter of the night, Dr. Karla Fiaoni. Dr. Fiaoni has been licensed to practice law in Illinois for over 32 years. She previously served as a Cook County prosecutor, chief of police for the city of Chicago Heights. She was the first female chief of police in Cook County, and she's also an author. She's a founding member of the Women's Criminal Defense Bar Association, and she actually served as president from 2015 to 2016. She's a board member of the South Suburban Bar Association and the Southwest Bar Association. She currently owns and practices criminal defense and family law. And Dr. Fiaoni has also been involved in multiple projects relating to domestic violence. Now, a warm welcome to Dr. Fiaoni.
Well, I am humbled by you calling me doctor. I really don't use that because I reserve that term for people who actually went to medical school. And so I would just rather you just call me Karla, but because I have such a high level of respect for the doctors in my life. So besides the resume that I sent in, I wanted to just throw a few things that are not in my resume so that we get a full picture of why I'm going to say what I say. What is not in my resume is that at the age of 8, my family was broken apart because of a pedophile father. And so then we were basically homeless for a while, going from relative to relative to relative. Then at 15, I became pregnant. I had a child at 16. I was a high school dropout. I lived in the Chicago Housing Authority. I participated in the what they call now the welfare system, which was aid to dependent children. I had 2 daughters. I have 2 daughters, and I have 6 grandsons, but we were also on food stamps. We had the medical card, which restricted us from where we could go to get service. And so throughout all that, I had really decent people that helped me see that education was going to get me out of my situation. So I come to this not so much as Dr. Fiaoni, but I come to this as a person who just really sees we need to do something, and it's critical right now. Dr. Harris, I loved your presentation. I absolutely loved your presentation, and your last cartoon is spot on. That's exactly what's going on, and that's exactly what we need to address. So I want everybody to kind of know where I'm coming from, because like you say, this is a difficult conversation. So I wanted to divide my time between what's going on with police officers and what's going on with my clients and the people who enter the criminal justice system, not voluntarily, but as defendants. Okay, so I don't think we can understand the whole picture unless we look at the need for fixing it and working together. So very briefly, I want to tell you a story about when I was chief of police. We had a police shooting in our city, and it was a very, very, very hard time. We had an individual that was shot by our police department. We had the FBI come in. We had the Illinois State Police come in. And at the end of the entire investigation, we were found as a department not to have done anything wrong. And even the Honorable Congressman Jesse Jackson Jr. wrote a letter in support of our actions and indicated that if our officers had not been fired upon, they wouldn't have fired back. But it took 2 years to get from the beginning to the end of that. And we were trying right before that police shooting to develop a relationship with everyone because we all live in the same town. So our city of Chicago Heights is about 35,000 people. We're south of the city of Chicago, and it's a very close-knit community where people have lived here, grandparents, and we have about 30% Caucasian, about 30% African-American, and about 30% Hispanic. So the history here has been everybody's grandfathers and grandmothers knew each other, everybody's parents. It's a close-knit community. But then again, you know, things started to happen and we had a lot of problems. So anyway, long story short, we had just started community policing. We had just started putting satellite police stations in the different neighborhoods. So every ward would have a police station and have community policing. We had just started expanding the DARE program. We had just started doing a lot of things, and then the police shooting happened. The reason I bring this up is because on the advice of the FBI, we had all the officers see a psychiatrist after the shooting, the post-trauma, to see, because they had to go back out on the street the next day. So before they could go back out on the street the next day and interact with the community, we wanted to make sure that we had an idea of what had just happened. And when I met with the psychiatrist at the end of the entire ordeal, he said to me, you know, Karla, I really thought they were going to talk about the shooting, but most of them didn't talk about the shooting. Most of them spent their whole time talking about the stress and the trauma and the anxiety and the depression. And he said, you know, a lot of them walked out saying, doctor, we've never had this chance before. We've never had a chance to unburden ourselves just about, you know, whatever was going on. And I found that like so interesting that this psychiatrist came in thinking he was going to basically debrief them about the shooting. And he ended up learning all about their lives and their experiences and how they felt when they went out in the street. So I just want to put that to the side for a second, because they are, what they go through is a big part of how they're going to interact with the community. But in the Chicagoland area, there is no doubt, and I want everyone to understand this, there is no doubt, based on my experience as a criminal defense attorney and trying to defend the Constitution of the United States of America, there is no doubt, if you are a Black man in Illinois, in the Chicago area, in the South suburbs, you have a much higher chance of being stopped, walking down the street, driving a car, going into your car from your home. There is so much going on with racial profiling that no one wants to admit. We have a Black mayor in Chicago, we have a Black police chief in Chicago, and yet it doesn't stop. It doesn't stop. My clients get stopped just leaving their homes. So imagine if you are a person of color in this area, getting up every day, knowing you want to go to work, knowing you want to get to work, but maybe your tail light's out on your car, maybe you might be going 5 miles over the speed limit, maybe you might not use your signal. You're going to get stopped if there's a police officer in the area. It's going to delay you from getting to work. It's going to delay you from taking your kids to school. This is still happening in 2022. Okay, so we have to accept that the trauma is not just from, you know, being a part of an event, like, you know, the police officer, they executed a search warrant and they kicked the wrong door in. That's not going to happen to everybody. So a lot of people aren't worried about that. But my clients are concerned every single day if they're going to get stopped, because the police are looking for weapons, the police are looking for guns. And so that if they stop you and they toss your car, search your car, and they don't find a gun, they send you on your way. They don't think it's a big deal because they send you on your way. But if they find a gun, then it goes into the numbers of we've recovered 5,000 guns this year or something to that crazy number. But what about every day? If just imagine, this is what just I can't wrap my head around, because I'm not the chief of police anymore. I'm not in charge of any department. But what I can't wrap my head around is that in 2022, it still seems to be okay to stop people based on some fabricated excuse and interrupt their day and cause them to have anxiety. Are they even going to make it through the day without a police encounter? If you could just imagine that. And even as women, we don't have as high of a threshold of being stopped. We just don't. So very recently, I just want to tell you another story. So I had a client that called me and said, he was in jail, so the wife called. We were leaving the house. We were going to the doctor. I was going to go take my son to the doctor. My husband was going to take the kids to the mall. We were going to split up, and then we were going to meet up later. We got in the car. The police swarmed us, and they pulled my husband out of the car. They searched the car. They found a gun. So I said, okay, let's see what happens. Let's go through the motion. She said, you don't understand, Miss Fiaoni. I have a Ring camera. I have all this on Ring camera. My husband didn't do anything wrong. None of us did anything wrong. We just left our house, got in our car. We're about to leave, and they came around the corner and they stopped us. We didn't. So she's telling me this story, and I'm thinking, I know the family. I just can't wrap my head around that they would just do this. But anyway, again, they did. So, but the point of my story is that when I talked to the state's attorneys, I told them what happened. And of course, they didn't want to believe me. I produced the Ring camera video showing this family on the west side of Chicago, leaving the house together in the middle of the day, putting their little dog inside, taking the kids, putting them in the cars, the police coming out of nowhere, stopping them, and then fabricating a police report that said that he pulled out and it was a normal traffic stop and the car had never moved. So again, I bring all this information to the state's attorney's office. The state's attorney's office that everyone wants you to believe is, to use your term, Dr. Harris, so woke. No, they're not. And I said, this is what happened. You have to dismiss this case. This is a violation of his constitutional rights. And again, the police said, oh, no, the Ring camera is wrong. No, he moved the car. I had to force this issue to a point where I threatened, and I know we're on video, but I threatened to go public with the information if they didn't take the Ring camera seriously. And they did take it seriously. And thank God they reviewed it. They realized that the police had not done what the police had said was not true. And they dismissed the charges against my client. But we have a man who almost lost his job because he was arrested, going to the mall with his children. Yes, was there a gun in the car? Yes, there was. Who did it belong to? I don't know. But as an American citizen, he has a constitutional right to privacy, not to be dragged out of his car. And I tell you this, we have to stop this aggressive policing of just taking people and not giving them their constitutional rights. If we don't stop this aggressive policing, we are just going to perpetuate this over and over again. It's going to be generational, because now let's take it a step further. We have mental health issues for children who are not being addressed. We have my clients who are charged with drugs who are self-medicating because they don't have access to health care. We have trauma from the occasional time when the police do hit the door in a search warrant with children in there, and we've seen videos. It's disturbing. It's more than disturbing. It's outrageous. I mean, to see these videos where the police are coming in the homes with the children. So all of these things have to be addressed, but I think that everybody in the whole system needs access to mental health. So trying to bring this together for you, I would say this. I've had clients that I personally felt like I was diagnosing them. I saw depression. I don't have a medical degree. I saw what I believe to be bipolar. I don't have a medical degree. I saw autism that I had to bring to the attention of the judge. I don't have a medical degree. All of these things, a lot of my clients are not getting diagnosed until they're actually in jail. And that is a travesty. So as I wrap this up for you, I say this: what can we do? I think there has to be a direct approach from your community to our community. I think that there has to be some direction given to us from your community as how you can help us. Okay, because I don't know what your availability is. Certainly, we all do pro bono work. We all do more than, you know, a lot of people. But I think that we need to look at how we're going to finally break the cycle. Because I have clients who I've represented their fathers. And it's getting to a point, if I stay in this long enough, I'll represent people who I represented their grandfathers. And I think that's when I just pull the plug. I think that's when I say, I'm sorry, I just can't participate anymore, because we cannot keep taking people of color, for the most part. There are other people who are poor and are, you know, in dire straits. But I mean, this is a discussion on racism and color. And for the record, I also have 6 grandsons of color. So I come at this from a lot of areas, and I fear for our communities in this country from a lot of different areas and a lot of different emotion. But we need to figure out why we're allowing police to police so aggressively. Do we really want the number? Do we really want so many guns off the street that we're willing to allow them to stop people and violate their constitutional rights and traumatize their children just so they can get a gun off the street? Is that what we're trying to do? I don't see the benefit to that. People will say to me, well, he had a gun in the car. Well, again, this is America. We have a Second Amendment. That Second Amendment extends to people of color. They also have a right to carry a gun. And I mean, we can't have a two-tiered system for the rest of our lives. It just won't work. So I say to you, as a psychiatric community, if there's something you can do to reach out to the judiciary, if there's something you can do to reach out to the state's attorneys, the public defender's office, our bar associations, if there's something that you feel that you can do with us to try to identify some of these problems and come up with some answers. I mean, I think if we don't do something in 2022, I'm very concerned about 2024. And for that, I would just say the day that we treat mental illness like hypertension and diabetes will be a great day, in my opinion. Thank you very much.
Thank you so much for all of your insight and so many factors and different considerations here. I know we're probably all very eager to get to discussion, but we actually have one more final speaker of the night, and I'm very eager and happy to introduce her. Her name is Miss Jessica Simpson. She holds an MPH, and she actually worked at the CDC for 5 years before matriculating to medical school. She's currently a third-year medical student at Loyola University Chicago Stritch School of Medicine. She is the founder of the Loyola Stritch chapter of White Coats for Black Lives, and she also served as their former president. Most recently, she actually helped author an article. It came out in spring 2022, the issue for the Journal of Law, Medicine, and Ethics, and it was titled "An Interprofessional Anti-Racist Curriculum is Paramount to Addressing Racial Health and Inequities." Let's give her all a warm welcome.
Thank you so much, Dr. Singh, for inviting actually White Coats for Black Lives to be a part of this. So I'm really happy that I'm able to represent the organization that I founded in 2020. I'm going to just briefly show you a little bit of a slideshow. So I'm going to try to share my screen and hopefully you can see this. Let's see. Okay. Can everyone see that? Can you all see? Okay. So I'm just going to talk to you about the medical student perspective. Again, I founded White Coats for Black Lives, the chapter at Loyola University Chicago Stritch School of Medicine. And the reason why I did that is because of this image. So there were about 300 medical students, my classmates, people who actually have already graduated or will be graduating, who, when the murder of George Floyd happened in May of 2020, we were all impacted by it. And just seeing someone being murdered on TV, watching the film over and over, we shared it amongst each other. We personally had trauma, and it wasn't just Black students. It was also white medical students, Latino medical students, people of different races and nationalities and sexual orientations and religions actually as well. And so I was honestly shocked to see so many people that were willing to stand up and say that they support the Black community and that they support Black lives. And so because of that, I thought, well, maybe we need to have some sort of organization that is a medical organization that is focused specifically on the Black community, because we do have a national medical organization for Black medical students and for people who are interested in matriculating into medical school, and that's focused on helping them. But what about focusing on helping the Black community, right? Because eventually we're going to be practitioners like Dr. Harris, and we're going to need to be able to communicate effectively, cultural competency, understanding our own implicit bias, and we need to be able to take care of that community. And so that's why I founded White Coats for Black Lives, the chapter, because I saw that there was already a national organization that was founded, unfortunately, because of another police shooting and murder in December of 2014. And so the mission at Loyola University Chicago for us is to eliminate racism in the practice of medicine, because the things that Dr. Harris actually talked about before of the social determinants of health, as healthcare practitioners, we also play a role in that. There's data that shows that unfortunately, Black patients do not receive the same quality of healthcare as other patients. And so it's important that we eliminate racism in the practice of medicine, both interpersonal, but then also addressing systemic racism. We need to foster crucial conversations aimed at, recognizing that racism is a public health crisis. This honestly sounds like it should be very easy to do, but conversations about racism can be very uncomfortable for some people. And this has been honestly my biggest challenge with the dean of my school, to get them to publicly say that, racism is a public health crisis. Actually, the doctor that Dr. Harris mentioned before, Camila Jones, she talks about, racism as a social determinant of health. And we don't see a lot of organizations even saying that. So we're focusing on having the conversation so that we can start making the connections and recognizing the data and being more comfortable, because unless we start having these conversations, we won't be able to address the root cause, which is racism, right? Again, and we're talking about systemic racism, but also interpersonal racism. And then preparing physicians to treat all patients with equal dignity and respect, right? Because the whole purpose of this is to protect the lives and well-being of our patients and our colleagues through the elimination of racism in the practice of medicine. And so the onus, of addressing this does not fall on the Black community. It does not fall on me. It does not fall on Dr. Harris. It does not fall on anyone who identifies themselves as Black, whether that be someone who's Latinx and also, identifies as Black. The onus is on everyone, right? So our organization, you'll see at the next slide, is a multicultural organization. There's people from different backgrounds who are interested in taking care of the Black community. And so we do this through research, advocacy, and policy. We also do this by addressing health disparities and healthcare quality, like I mentioned the research before. And then obviously we need to focus on wellness and mental health. That's the topic for today. Oops. And so this is the founding board. I just wanted to show that we have majority women, which is actually the majority at our school is about 60% women. But it's also important that we have white men who are involved in this, because a lot of times they're the ones who are the decision makers, right? And so that's good. And then this is our current board. And again, you see the diversity, right? It's not just one particular race or gender. Well, in that case it is, but our members are also, we have some members who are who are not women. And so some of the things that we do are, education, because education is really important. Not everyone has an MPH, not everyone understands, what racism is or how it affects health. Not everyone is familiar with the story of, Henrietta Lacks. And so we decided to have a social justice book club, which was really actually pretty successful. We do that over the summer because that's when medical students are less likely to be studying all the time and not have time to read books. And so we worked with the nursing school because, again, the onus is not just on physicians, it's everyone who's in the healthcare profession. And we also worked with the law school most recently to talk about medical apartheid, which is a book I highly recommend that everyone reads if you haven't read it already. Another thing that we did during Black History Month is talk about the Black physicians and scientists that have actually, made a lot of headway in the field of medicine and science. All of you probably are familiar with Dr. Kizzy, who is the one who made the COVID-19 vaccine. So we highlighted her as well. Dr. Harris would definitely be someone that we highlight, right? Being the first African-American woman to be the president of AMA. These are all important people. And I think it's important for everyone to know about them, right? Because again, we're taking care of a multicultural community. Then we had a screening where we watched a couple of films and then we discussed them in small groups. We found that small groups are the best way to kind of have, more interpersonal conversations. The dean of our school actually attended some of those. We had residents attend, people who hold leadership positions. And it's really important because not everyone is aware of the effects of being a Black person in the medical profession. That's actually what Black Men in White Coats was about. Unfortunately, less than 2% of the medical community are Black people, right? And so we need to increase those numbers, but we also need to make sure that we're increasing numbers and making a safe space for them in the medical field, which is another component of White Coats for Black Lives. We talk about, the freedom riders, because anything that's related to race is going to be related to someone's health and well-being, right? We talked about those social determinants of health, which include education, income, and where you live, your zip code. So all of those things are important. Another thing that we did recently, actually last week, we had a racial justice panel with a doula, someone who works in health policy, she's an attorney, and then a physician who's an OB-GYN, just to talk about an MLP, which basically is it's people who are working in the health field and people who are attorneys coming together to help to address some of the disparities that people may have in order to have the best health for them, right? So maybe someone is struggling with housing and we can work with the attorney to write a letter, to help that person to secure housing or maybe not have to pay their rent for a month or those sorts of things. And so that we can get creative in ways in which we advocate for our patients. Again, we had an Advocacy 101 workshop, which actually we talked about at the time it was for the election. So we made sure that people registered to vote. We had pens, we did all of that fun stuff. And then we had an implicit bias workshop, which was not only for medical students, but also for residents. It focused on awareness. So what exactly is implicit bias? And then being mindful of, what lens am I using when I look at a patient? We talked specifically about pain, which I'm sure all of you are familiar with, that unfortunately, again, Black people are less likely to be taken seriously for their pain and therefore less likely to receive medication to address that, especially sickle cell patients. And then we also had a healthcare as a racial justice issue 4-part virtual series, and you can see that here. So our main focus has been on education, but then we also did advocacy. You may be familiar with Mercy Hospital. Mercy Hospital is located in the south side of Chicago. It was on the verge of closing. It's a safety net hospital. Unfortunately, there are a lot of safety net hospitals that were on the verge of closing prior to COVID, but COVID was just kind of the tip of the iceberg. And so we found out about that. We decided to rally behind the community members who were already working to keep their hospital open. And I really have to say that, being a physician and wearing your white coat, and I testified, we rallied, we marched, we were on the news. All of those things I think really helped. And again, it's us advocating for the community. So we're not taking over, we're just letting them have the limelight, right? But we're expressing how it's important from our perspective as future doctors in my case, or people who are already physicians that testify. And unfortunately, we were able to keep the hospital open. It was sold to new management, and we're really proud of that. And then, so the main important thing that we want to talk about here in this space is wellness and mental health, right? We want to talk about it in the space of our physicians, you know, and our medical students, and also with our patients. I think a lot of times we forget about the impacts that it has on us as healthcare providers, and that's also important. If we ourselves are not well, we're not going to be able to provide the best care for our patients. So we actually had an adult mental health first aid instructor come in and talk to us about the stress related to racism and how it impacts us. And I think at the time it was really important because we were seeing a lot of you know, footage of police violence in the Black community, and people got very vulnerable, and it was a nice event. I think it's something that can be replicated too within a healthcare profession. I know it's hard to find the time, but I think we need to make time for these things, right? So we can talk about privilege, you know, in the sense that we're all educated folks, and we have that privilege of being, you know, educated, and but then also discrimination that we experience, racism, and then how we can collectively heal, how we can advocate for one another if we see things instead, and you know, mention it. We also focused on meditation, and fortunately, where I got my master's at University of Louisville, Miss Karen Newton and I are still friends, and she offered free series for medical students. So we had 2 sessions where we learned about Kuru mindfulness, and then everyone that attended that was also, we paid for that through White Coats for Black Lives. We sold pens, and the money from that we were able to use to pay for everyone who wanted to have the app for the rest of the time that they would like to use it. So it's nice because then, you know, you can meditate for 5 minutes, 10 minutes, 20 minutes. It's guided meditation as well as just timed meditation. And it's really important, especially if you're doing this work all the time, especially if you are a minority, and you have to also take care of yourself. And so we talked about that, and obviously we want to talk about the neurobiology of it because we're medical students. And then so, you know, IPS asked me to tell you all about things that you can do. So these are a few things that I think that we can all do, including myself. It's a good reminder for me as well, is to listen more to our patients and talk less, and to ask our patients about what happened in your childhood that's related to who you are today. And, you know, kind of have them maybe reflect on that. Some people may not necessarily be aware of their childhood traumas and how that relates to their mental health and their overall health and well-being now. And we know that active listening heals people, just being there to listen to folks, you know, that's the importance of talk therapy, being mindful of our own implicit and explicit biases. And I think that comes from practice of meditation and mindfulness, because it helps you to slow down your mind and to be more aware of the thoughts that you're having. It's also incredibly important for us to advocate for our colleagues and for our patients. One way you can do that is by wearing pens that actually promote and create a space where people feel comfortable to talk to you. There's actually data that shows that if you have a pen, the data was about wearing a pen that talks about domestic violence and saying that you can talk to me about this. Patients were more likely to just talk about it without even being asked, just by wearing that pen. And I can tell you, I've also been asked questions about my pens that I wear. You know, I'm wearing the White Coats for Black Lives pens. And it really does help patients to know that you are an ally for them. And then I think what's really important is we should really love our patients as our family members. And I know that may sound a little bit strange, but I think if you do, you know, take the approach of viewing this person as someone that's your family member, you are going to go above and beyond. And we hopefully will not have those statistics where Black healthcare providers are providing more thorough and sufficient care for their Black patients as opposed to others, right? And then learning the history of systemic racism in the US healthcare system and educational institutions, I think, is critical to understanding why sometimes people are resistant to even go to see a physician, or resistant to the law, you know, the criminal justice system, because of the histories that plague us today. So that's my brief PowerPoint, and I will stop sharing. And I thank you all for your time and attention.
Thank you so much, and thank you again so much to all of our wonderful panelists today. We'll go on and actually stop recording the session at this time so we can facilitate open discussion and transition